Having undergone specialist training in more fields eye hospital in the United Kingdom, I had returned to my hometown of Ipoh in 1974 with the aim of providing affordable quality eye care services to my patients. The Eye Clinic was founded at that time, and from being a solo eye care practitioner in this clinic, the Eye Center was subsequently born in 1999 with the inclusion of 2 other consultant eye surgeons. Since then, we have grown to become a Ministry of Health recognized day surgical center. And to date, the Eye Center is the largest private group practice in Para with 4 consultant eye surgeons.
The Eye Center is a one-stop comprehensive eye specialist center, and we're able to cater to all the eye care needs of our patients. We pride ourselves having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first lens-star optical biometer in Para, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At the Eye Center, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power, as well as contact lens fitting. They also provide vital support to our LASIK services. At the Eye Center, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with parallel precision.
At LEC Center, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists, and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
的星期在路堆上替形式按，根据碰撞毫米被指向2。
Hello, good evening, everyone. Good evening. Thanks for joining us this evening to have this session with Dr. Lim. So Dr. Lim today is going to share about the problem with children again, right, Dr. Lim? About
Yes,
glasses, where parents usually will face the problem where they have to keep continuously changing their glasses because the power changes too fast. So Dr. Lim is going to share a bit more about what is the cause, what is the, in more in-depth, I believe, you know, and how you actually can slow down the regression of this so-called myopia, which is a short-sightedness. So without further much ado, I would like to have a brief introduction of Dr. Lim. Okay, Dr. Lim is, Dr. Lim Eng Hock is actually our senior consultant, and he also actually attained his master in ophthalmology in University of Malaya Hospital in 2003. And in 2004, he's also the head of ophthalmology department in the hospital Teluk Intan. And he's also a very highly experienced and competent surgeon for procedures such as cataract with wavefront, toric, multifocal intraocular lenses, LASIK procedures, pterygium excision with conjunctival graft using the fibrin glue, trabeculotomy surgeries with for glaucoma management, screen eye surgery, and eyelid surgery. Dr. Lim is also our visiting consultant in Community Specialist Hospital as well. So let's have Dr. Lim on board, please. So Dr. Lim, you can take over now to give us a bit more in-depth about this so that more parents or more mothers especially will have less worry knowing that there is something, a remedy or a solution for them.
Okay, so I will share my screen now. Just give me a second.
Thank you, Dr. Lim.
Okay. Okay, you all can see my screen, right? Okay, so the title of my talk this evening is actually Help, I have to change their glasses again. So basically this actually infers that your child's power or short-sightedness is actually increasing and you have to change the glasses again. So we'll go more in depth about this and see whether there's anything can be done or not. Okay, first, what is myopia? Okay, many people may not be familiar with the word myopia, but the layman term, I'm sure most of you would have heard of it. Is actually myopia is actually short-sightedness or nearsightedness. I believe short-sightedness is a more common term in our setting here. Okay, so what actually is this short-sightedness or myopia? First, you have to understand how does the normal eye see. Normal eye means that an eye without short-sightedness or myopia. Just hold on, let me get my pointer first. Okay, arrow. Okay, so this is actually the eyeball here. So in a normal eye without short-sightedness, light enters the eye and it gets focused exactly on the retina. Retina is actually this layer of nerve right at the back of the eyeball. Okay, so in a normal eye, the image is focused precisely and very sharply on the retina itself. See, focus point is on the retina. Images are clear. Now, in the myopic eye or the short-sighted eye, okay, again, here is the normal eye. Okay, normal eye, light focuses right on the retina here, on the retina. Now, in a myopic eye or a short-sighted eye, most of the time the eyeball is considered to be too long, okay, or the cornea maybe is too curved, more curved. So as a result, the light, when it focuses, it does not actually reach the retina. The image forms just in front of the retina actually, so it falls short of the retina. So the result of this is that the image will be blurred. The person will see a blurred image. And how do we correct myopia? How do we correct this short-sightedness? Well, as everyone is familiar, of course, you have to wear glasses, okay, or contact lens. So when you wear glasses, because of the nature of the glasses, the light is actually refocused properly so that it will fall now, it will fall exactly on the retina so that the short-sighted person who is wearing glasses, the correct glasses, can see a clear image. Okay, so this is actually what myopia is and how it is corrected using your traditional glasses. Okay, myopia actually is, as we all know, is actually very common. So much so that I would call it the other pandemic. Well, we all know what the current pandemic is, but actually there is another the other pandemic. Okay, and that I believe is actually myopia or short-sightedness. Okay, now currently in the world, I would say that the global prevalence of myopia is probably like around maybe 20 to 30% of the population. Now it is actually based on studies. It is actually estimated that by the time we reach 2050, half of the world, 50% of the world would actually be myopic. Okay, this is in the year 2000. Myopic population is about 22%, but then it is projected that by 2050, 52% of the world population will be myopic. So it is truly a pandemic. So again here, global increase in myopia prevalence from currently to 2050, okay? Here actually the thing that you have to, you can actually note of quite interesting is that this prevalence of myopia is actually highest in this Asian region here, from the East Asia to Southeast Asia. Okay, so much so that by 2050 it is projected to reach numbers of more than 60% of the population will be myopic. Okay, and also studies also show that 70 to 87% of Asian school children and young adults have myopia. Okay. Myopia here is defined as at least 50 degrees, or in medical terms, it's actually minus 0.5 diopters. And since the lockdown, as we know, since the lockdown, the rates of myopia has also increased due to online classes as well as more time spent indoors. Okay, so from here we can actually deduce that online classes, I mean, excessive use of your near vision, actually, that's what it means actually. It contributes to this increasing rate of myopia. Okay, so what causes myopia? Well, there is no actual single cause. It's actually a combination of a combination of factors, multiple factors. Okay, but I think the one that has strongest evidence is that prolonged and frequent near visual activity. That means prolonged use of your near vision. So if you're always looking at things close up to your face, you know, that means looking at your books or your gadgets, okay, your devices. Okay, excessive use of eye muscle for focusing on near contributes to elongation of eyeball and hence development of myopia and its progression. Okay, so if you're always using your eye to look at near things, there will be excessive use of your eye muscle, what we call the ciliary muscle or the accommodating muscle. Okay, and this is believed to be a factor which contributes to elongation of your eyeball. So basically, if your eyeball elongates, that means becomes longer, you will become short-sighted because the light that is focused into the eye, it will fall more and more in front of the retina rather than on the retina. So actually, how does the light focus? How does the eye focus light? Sorry, So if we look at a light coming or from a distant object, distance focus, okay, the ciliary muscle or your focusing muscle will be in a relaxed state, and the light will focus exactly on the retina here. But if you are looking at something near, something close up, maybe your phone or maybe your book, okay, for the light to be focused on the retina, the ciliary muscle of the eye has to contract and change the shape of the lens, this lens in the eye, make the lens more convex so that the light from near object can be focused on the retina. So basically, when you're looking at a near object, your eye muscle, the ciliary muscle, is actually under tension. It has to contract to help you to focus. Okay, so it is believed that this prolonged use of this contraction of the ciliary muscle contributes to actually the elongation of your eyeball and hence your progression or development of myopia, short-sightedness. Okay, other contributory factors in myopia include genetic factors. Okay, there is no definite myopia gene as such. Okay, It's probably a complex interplay of many different genes. So many different genes probably contribute to development of myopia, not a single gene. Okay, the evidence for genetic contribution is also from the observation that parents who are myopic are very more likely to have myopic children as well. And Asian race has also been found to be having a higher prevalence of myopia. Well, this may be genetics, or it may, it may be genetics, or it also may be because maybe the Asian people or Asian children, maybe they spend more time on books. Okay, they are more, maybe they're more academically motivated or inclined. Okay, one thing I have to make you aware of is determination of myopia in a child. Okay, the determination of myopia in the child means that like basically we need to measure how are we going to measure the power, the short-sightedness power in a child. It's actually different from an adult, very much different. Okay, young children generally, if you want to measure their eye power, their short-sightedness, basically you need something called a cycloplegic refraction. Okay, whereas adults usually they just need refraction. They don't need cycloplegic refraction. So what is meant by cycloplegic refraction? Okay, cycloplegic refraction is to obtain an accurate reading of the myopia. Because children, they have a strong accommodation focusing muscle. So this may result in a falsely high reading on usual refraction. So in cycloplegic refraction, we actually use these eye drops. We instill eye drops into the child's eyes first, and these eye drops will actually relax your ciliary muscle. See this ciliary muscle here. So once the ciliary muscle is relaxed by the eye drop, then only an accurate power of the eye can be measured. Okay, because in children, this ciliary muscle is very strong. Sometimes even when they're not actually focusing on anything, the ciliary muscle itself may still also be in a contracted state. So if you were to measure the power at this time, you may get a falsely high short-sightedness reading. So for children from like maybe below 10 or maybe even below 12 years old, usually we have to do a cycloplegic refraction. We have to put eye drops, wait until this ciliary muscle is paralyzed, then only we can accurately check the power. Now, this cycloplegic refraction is something which can only be done in a doctor's, an eye doctor's center. Okay, because this is actually a drug. The eye drop that we use is actually a drug which normal optical shops outside they are actually not legally allowed to use. So if a child were to go to them, they will probably not be able to get a very accurate refraction. So it's advisable that if it is a child, then I think they should get a cycloplegic refraction at an eye doctor's clinic. Okay, now why the need for control of myopia? Okay, some people may think, what's the big deal about short-sightedness? My child can see well if it's just that he needs to wear glasses. If he puts on a pair of glasses, he can see very well, just like normal. Maybe when he's older, he can just do LASIK and get rid of the glasses even. Okay, well, it's not just a matter of putting on glasses and you can see well. It's because with increasing levels of myopia, if you were not to control the short-sightedness and the level of short-sightedness or myopia were to just keep increasing, the eye will also have risk of acquiring certain blinding eye diseases. Okay, so certain blinding eye diseases can also increase significantly. Now here, blinding is different from short-sighted. Short-sightedness, basically you wear glasses, you can see well, you have normal vision, 6/6 vision. But if you have these blinding diseases, even if you wear your glasses, you will not be able to see. So that's why it's a disease. Whereas myopia is, well, it's not actually a disease, it's just a refractive error. Because with glasses, you can see well. Okay, so what are these blinding diseases associated with myopia? Okay, number one, there's something called retinal detachment. Okay, retinal detachment, and then there's a myopic choroidal neovascularization. There's myopic macular degeneration. Okay, there's glaucoma, there's cataract. Okay, maybe 2 or 3 of these terms may be a bit familiar to you all, but maybe some of these terms are maybe you all have never heard of it. Okay, so I will go a bit in detail about these conditions. So, okay, firstly, retinal detachment. So retinal detachment is, as you all know, at the back of the eyeball, there is a layer of nerve called the retina. retina is, that's where all the images that we see, it's focused on the retina. So sometimes in people with myopia or high myopia, they are more prone to get retinal tear. Okay, a retinal tear means that a tear occurs in this layer of retina, and when a retinal tear happens, there's a very, very high chance it will lead to something called retinal detachment. Okay, that means this layer of retina, it will progressively peel off from the back of the eyeball. So in other words, yes, it will cause blindness, and major surgery is required. And sometimes if the condition is very serious, even after surgery, your vision may not be like 100% like original. So this is obviously a very serious condition, retinal detachment. And the risk of getting this retinal detachment increases along with your level of myopia. That means the higher your short-sightedness, the higher your risk to get this condition, retinal detachment. The other condition, another condition is actually called a myopic CNV. CNV means choroidal neovascularization, sorry. So in this condition, people who are myopic or highly myopic, they are also prone to develop this condition in which abnormal blood vessels will grow in one of the layers of the nerve layers in the eye. Okay, so these abnormal blood vessels, they will cause bleeding. They may rupture, they may cause bleeding, and this bleeding, of course, will obstruct your vision, will impair your vision, and will cause scarring as well. So that sometimes even after resolution of the bleed, the scarring can result in actually permanent damage to your vision, permanent damage. Okay, another condition we are associated with this short-sightedness is something called myopic macular degeneration. Okay, so in this condition, because of the progressive elongation of the eyeball, your choroid, your retina, that means basically your nerve layer at the back eye, it gets progressively stretched thinner and thinner. So this is actually this particular patient is actually an 18-year follow-up. So in the initial years, at the beginning of the 18th year, you can see this patient already has what we call a myopic fundus. That means the nerve layer can see those typical appearance of a highly myopic person, okay, where the retina and the choroidal layer is very thin. So as age increases, as age progresses, the myopia, the power also increases, and progressively this macular, the retinal, the central retinal area here, it becomes progressively thinner and more atrophic. Eventually, at the end of the 18-year follow-up, we can see that there are many areas which have actually undergone atrophy. Atrophy means that the function in those areas are probably very much diminished. So obviously at this stage, a patient's vision will have deteriorated by a lot. Okay, so this is called myopic macular degeneration. Okay, the other condition associated with myopia is actually glaucoma. Well, glaucoma, yes, it can occur in people who are not myopic as well, but it's just that if you are myopic, your risk of getting this glaucoma is probably like, could be like 2 to 3 times higher than people without short-sightedness. So glaucoma is a disease in which the eye pressure, the pressure inside the eye becomes too high. So when that happens, and if it is not detected and not treated, not controlled, this high pressure in the eye will lead to progressive damage to your vision. So here, I'm just going to show the stages of glaucoma, untreated glaucoma. So in the first frame here, we have normal vision. As you can see in this frame here, all the 4 quadrants, up, down, left, right, all 4 quadrants of the view can be seen. In early glaucoma, if you look properly, you notice that parts of the peripheral field, parts of the sight vision here, you can see has become dark. Okay. So that means the sight vision is actually deteriorating. And if at this stage, if it's still not treated or not detected, the condition will become advanced. So advanced glaucoma, you can see a large part of the sight vision, a large part of the peripheral field of vision has actually disappeared, so that the patient can see mostly just the central area. Notice that the sight details here, like the rest of the blue car, this part of the car here, you can't see anymore. Can you see the central part? And if the condition is still not treated and just left alone, in the end, extreme glaucoma, this is what we call tunnel vision. What you can see is just like a tunnel, just like when you look into a tunnel, and at the end of the tunnel, you can see this view, just a central tunnel vision. So this is actually very, very advanced or extreme glaucoma. So glaucoma is a condition where if you did at any stage that you detect it, you cannot cure it. It will not revert back to normal. Whatever stage you discover it, maybe at this stage here, you can start treatment, you control the pressure of the eye, you can just maintain your level of vision at that particular stage. You cannot go back to this stage. Huh? So glaucoma is, of course, it is obviously a very serious and blinding disease. Huh? And it is also, as I mentioned, the risk of it is actually increases with your myopia. Okay, lastly, a condition which is also very common, cataract. Yes, cataract happens to everybody sooner or later because the main thing is that it is actually age-related. Okay, but if you have myopia, short-sightedness, or high short-sightedness, the likelihood of you developing cataract is actually much higher and usually occurs at a much earlier age. Well, cataract is, I would say, more easily remediable. Most of the time, surgery is very successful and vision can be restored to normal. Okay, here just a table showing the risk compared to non-myopic eyes, the risk of these short-sighted eyes compared to non-myopic eyes. Okay, so here glaucoma. If you have a power of, let's say, about myopia of -1 to -3, that is actually considered mild myopia. Even then, with this mild myopia, your risk of getting glaucoma is actually 2.3 times higher than people without short-sightedness. Okay, and similarly here for cataract, it's 2.1 times. Retinal detachment, 3.1 times. Myopic maculopathy, 2.2 times. And as the power of the eye increases from this, mild myopia here to -5 or more than -7, this is considered high myopia. So as the power increases, so does your risk of getting all these diseases here. See, glaucoma, when you have a very high myopia, it can be up to like more than 3 times the risk. Cataract, more than 5 times the risk of normal people. And retinal detachment, similarly, and this myopic maculopathy as well. And if your power is really very high, more than -7 or more than 700, your risk of getting retinal detachment is actually, imagine that, 44.2 times, more than 40 times higher than normal people. And your risk of getting this myopic maculopathy, nerve degeneration, is actually more than 100 times compared to normal people. So, and obviously from this table itself and from what I've just mentioned, it's obviously very important that there is a need to control myopia. It's much better to let myopia remain at just maybe this level here rather than to just let it go uncontrolled and reach levels like 700. Because obviously when you reach this level, your risk of getting all these blinding diseases increases many, many, many times. So that's something we wouldn't want. Okay, so what are the ways to control myopia? Okay, myopia actually, yes, it can be controlled. There are ways to control it, fortunately. Okay, so I would say broadly, we can divide the ways to control myopia into these few classes here. First is lifestyle-related recommendations. That means something that you as a parent or as a family can practice. Okay, the second option, the second method is actually something known as myopia control glasses. Yes, myopic people, myopic children, short-sighted children, yes, they do need to wear glasses, but there is also something called myopia control glasses. These are special glasses, which later I will explain a bit more, how they can help to actually control your myopia. Contact lenses. Okay, contact lenses, usually the common use of this is actually, it's actually like for, well, some people they wear because of convenience for like sports activities, or maybe they just want to, they think that they don't look so good with glasses, so they want to wear this. But actually there is actually a role for special contact lenses in the control of myopia in children. Okay, later also we'll go to that. And then this one here is another option to control myopia. This is by using eye drop. So this again, later I will just talk a bit more on that. Okay, so to go a bit more in detail now on each individual method. So lifestyle recommendations. Okay, one thing that you can do, which is very, very important as a parent, is actually limit the screen time and near work. Well, this is of course not easy to do, especially nowadays, but it's something that we actually need to do if you want to control the myopia. Okay, now it's actually recommended not more than 2 hours of screen time after school. Okay, And we also should encourage something called the 20-20 rule. That means for every 20 minutes of looking at near, okay, looking at doing your homework or looking at your device, the child should actually take a break, okay, by looking into the distance for 20 seconds. Okay, so basically here in this diagram here, so every 20 minutes of looking at your phone, your gadget, or doing your homework or reading a book, every 20 minutes, you should take a 20-second break to look at something far away. Okay, you maybe just look out the window, or maybe even look at the TV at the end of the room. Then that's fine, as long as you're looking at something which is at least 20 feet away in the distance. Okay. So this will actually allow time for your eye focusing muscle, for the ciliary muscle or the accommodating muscle, give it some time to take a break. Okay. So because you know that the more prolonged use of this ciliary muscle, this accommodating or focusing muscle, the more you use it, the more it can cause elongation of the eyeball and hence progression of your myopia. So this 20-20 rule is something that we should encourage in our children. Now, the other thing is this lifestyle. Okay, lifestyle related recommendations is actually try to let your child spend more time outdoors, maybe 2 hours a day if possible. Especially nowadays in these COVID times, actually people tend to spend less time outdoors as advised. Okay, but actually exposure to bright natural light like sunlight, this actually has been shown to actually help in the prevention of onset of myopia actually, but I believe that it can also help to control myopia. Okay, so if you are exposed to this bright light like sunlight, one of the theories is that it results in production of this neurochemical called dopamine in our body, and this dopamine actually can inhibit excessive eye growth. So that means it can stop our eye from growing too fast, too long. So this actually means that it will it will curb the progression of myopia. And also when you're exposed to sunlight, our body produces vitamin D. So vitamin D also has been shown to have this inhibitory effect. It inhibits excessive eye growth as well. Okay, so exposure to sunlight, it does help in preventing onset of myopia as well as probably can contribute to slowing the progress of myopia. And the other thing is, if you don't spend enough time outdoors, you are if you spend more time indoors, obviously you get less physical exercise. So this actually leads to higher production of this insulin growth factor 1 hormone, and this excessive production of this hormone may actually cause increased eye growth. Okay, so all this actually suggests that spending time outdoors, where you're exposed to natural sunlight, where you can run around and play, all these things actually they have contributory effects in actually preventing onset of myopia as well as controlling the progression of myopia. So spending time outdoors is actually important. Okay, coming to the next part of the use of special myopia control glasses and this contact lens. To understand actually how these special glasses or contact lens work, you have to understand this concept of peripheral hyperopic defocus. Peripheral basically means sight, okay, the sights, okay. So actually this peripheral hyperopic defocus is something which is actually strongly linked to increased eyeball growth. Okay, that means if you have this peripheral hyperopic defocus and you don't correct it or control it, it's likely that the child's eyeball will experience increased eyeball growth. That means the myopia or the short-sightedness will progress faster. So what is this peripheral hyperopic defocus? Okay, here we are looking at the eye here. This is the front part of the eye, obviously. Light enters, images is formed behind here on the retina. Now, in an uncorrected myope, that means a myope is a short-sighted person. Okay, if it's not wearing glasses or any kind of correction, this is how light focuses. Centrally, the light will come it will fall short of the retina. Retina is here at the back here. This is the back of retina. So if it's a short-sighted person, the light will focus in front of the retina rather than on the retina here. But the thing is that in these short-sighted people, although the center of the light is in front of retina, but the side here, the peripheral region, sometimes the light may actually be focused behind the retina at a virtual point behind the retina. Okay, so this part of the focus where is behind the retina, this is actually called your peripheral hyperopic defocus. And this peripheral hyperopic defocus is actually found in a lot of short-sighted children or people. Okay. Now, if you were to make so-called the traditional glasses or your so-called normal single vision glasses, these glasses, what they do is they will focus the central light accurately on your retina. See here the difference compared to the first. First, this is without glasses, so the image form is in front of retina. Okay, but if they wear the normal glasses, this central light, the image is actually formed directly on the retina, so they can see very sharp. The central vision is very sharp. But this normal single vision glasses, your normal glasses, they don't correct this peripheral part here. Okay, the peripheral part, the focus is still behind the retina rather than on the retina. So if you don't correct this peripheral hyperopic defocus, this will contribute greatly to your increase in your short-sightedness. Okay. Now, so obviously, the best correction or the optimal correction is actually if you can create a correction where the central light is focused right on the retina and the peripheral light is also focused on the retina or even in front of the retina. In fact, if you can focus the peripheral light in front of the retina, what we call a peripheral myopic defocus, this is actually shown to be even better at controlling your myopia increasing. That means you're controlling your increase in the eyebrow growth. Okay, so if there is a device, a type of glasses or contact lens which can achieve this, that means focus the light centrally on the retina, as well as correct your peripheral hyperopic defocus, that is actually the ideal correction to control myopia. So yes, there are glasses and there are also contact lenses that can do exactly this, that can actually correct your peripheral hyperopic defocus. So let's have a look here. Okay, glasses and myopia control. So actually there are a few types of glasses which actually can correct the peripheral hyperopic defocus, as I mentioned just now. So here I'm just mentioning this is a traditional or your so-called normal glasses, your single vision glasses here, single vision glasses. Now these glasses, single vision glasses, they do absolutely nothing to slow down myopia progression. Okay, and the type of glasses that can actually help to control your myopia are actually these types here, the bifocal and the progressive addition lenses. Okay, as well as something called the myopia control glasses, which also consists of a few types like the peripheral plus design, the multi-segment design. All this later I will just show a bit more. So basically these are special glasses, your bifocal, your progressive addition, your myopia control glasses, all of them, they correct your peripheral hyperopic defocus. So again here, this diagram, this one in the first diagram, this is actually using your normal single vision glasses. So this type of glasses, your normal glasses, they can focus light very accurately on your retina at the center. So you can actually see very well, your central vision is very clear. Okay, but here your peripheral, the peripheral retina here, the peripheral vision here, it does not correct this hyperopic defocus. The focusing of the light is still falls behind the retina here. So if this part is not corrected, as I mentioned just now, this contributes to your progressive increase in your short-sightedness. Now, if you were to get this special, all these glasses which I mentioned just now, your bifocal, progressive addition, your myopia control glasses here, the way they correct the focusing is very much different. Centrally, yes, it's the same. They focus light accurately right on your retina, but at the sides here also they correct the focus. So they will pull the focus from behind the retina, they will pull the focus forward so that it's at least on the retina or even a bit in front of the retina like this. Okay, so you can see that the focus is actually much more accurate. So this hyperopic peripheral defocus is actually eliminated using these special glasses. So that means that this will, if you wear these glasses, you will be able to control the progression of the myopia in the child. So here just to show the different types of myopia control glasses. So there are a few types. This one I mentioned just now, bifocal. Okay, bifocal means, see, this is a spectacle lens. So the lower portion actually has a reading portion. That means there's an increased power for near. Okay, whereas the top part of the lens is for the distance. Okay, similarly here, this one is something called a progressive addition. Okay, so the top part is also for distance, and as you go lower down here, similarly, there's a part increased power for the near vision here. And then these two here are special myopia control glasses. In this type of glass here, sorry. Okay, in this one here, this is actually this particular brand is called Zeiss Myovision. So the central part is actually for distance, but the surrounding here is actually what they call plus power for your reading, as well as to actually correct your peripheral hyperopic defocus, as I mentioned just now. And here is actually one of the latest concepts, similar to this one here, but the power at the side here is even stronger, so that they can produce, they can even correct your peripheral hyperopic focus even better. Okay, this is actually called the Hoya MyoSmart. Okay, so actually just to mention this Essilor Myopilux, this is the brands for this, and this Hoya MyoSmart is actually available in our optical shop, Eye Care. Later, we'll just show you a short video on that as well. Okay, contact lenses, they also play a role in myopia control. Okay, although maybe not so commonly used as glasses, but they do have a role as well. Okay, basically there are, I would say, two types. One is autokeratology lenses, or commonly called auto K. So these are actually special contact lenses which are worn only at night. Unlike the normal contact lenses which adults wear in the daytime, this is actually the opposite. They are worn only at night. And when you wear them at night, what they do is actually they have a flattening effect on your central cornea. So when you flatten the curvature of the cornea, this actually helps to focus the light accurately. So it actually sort of corrects your myopia. And this contact lens, as it presses on your cornea, it also causes the steepening effect on the peripheral cornea. And this steepening effect on peripheral cornea will correct the peripheral hyperopic defocus I mentioned just now. So similarly here, this autokeratology contact lens, it can also correct the peripheral hyperopic defocus. So that's why it is considered as a myopia control device as well. The other type of contact lens is, this one is different. This one you wear during the day. It's called a multifocal contact lens. And out of the two brands, this is actually one particular brand here, MySight, okay, by Cooper Vision. So this lens, it has different zones within the contact lens itself to correct the short-sightedness, as well as zones here, correction zones here, to correct your peripheral hyperopic defocus, to create this myopic defocus. Okay, so this myopic defocus is the one that controls your progression of myopia. So same as your myopia control glasses, the concept, the principle is actually the same. Here is actually the auto K, which I forgot to mention just now. Yes, auto K, so it flattens the central cornea here, so that the central light is focused accurately on the cornea, on the retina, sorry. And the contact lens presses on the central cornea, so as a result, the peripheral cornea here becomes a bit thicker or steeper, and this helps to correct the peripheral hyperopic defocus. So it creates this myopic defocus. So it brings the focusing of the light in front of the retina. Okay, so this is actually beneficial to correct your, to stop the progression of the myopia. Okay, one thing is with the use of contact lens is that there are certain risks. Okay, so the child and the parents, they must know about maintenance and hygiene with regards to contact lens use. Okay, because contact lens use, yes, there are certain risks. These are just a few examples here. Yes, they may cause allergy. This is something called giant papillary conjunctivitis, sometimes seen in contact lens users. And sometimes if improper maintenance or hygiene may result in this corneal abrasion. Corneal abrasion basically is like scratches on the surface of your cornea, your eyeball here. Okay, and if this corneal abrasion gets infected by bacteria, you may end up with something very serious called a corneal ulcer, corneal infection. Okay, so this is actually an area where there is infection by bacteria. Now, the importance of this condition is that even after this infection has resolved, this area will be permanently scarred. Okay, there will be a white scar. A white scar will be left behind. And depending on the location of the scar, especially if the scar is right at the center of your pupil, your vision will be permanently impaired. So this is some risk with contact lens use. So if you're using this method, then you must be very diligent with regards to the maintenance and the hygiene regime. Okay, here is myopia control using eye drops. So this eye drop actually is 0.01% atropine. Atropine is actually a substance derived from a plant. This I think it's a belladonna plant, Atropa belladonna. Okay, and studies show that it has efficacy of about 60% in curbing the myopia progression. So this drug actually commercially is called myopin. So myopin, which is 0.01 atropine, it has a relaxing effect on the eye accommodation. Okay, eye accommodation means that it has an effect on the ciliary muscle, the muscle for focusing for near, which I mentioned earlier on. So this eye drop, it can relax that muscle. So if you relax that muscle, you are reducing your accommodation. So this will reduce the stimulus for eye growth. So this controls your myopia also. But myopin alone, it does not correct your myopia, of course. It just relaxes the muscle, but it doesn't focus the light on your retina. So of course, if you're using myopin, you also must use glasses or contact lens. If you want a second method to control the myopia, then you can use what do you call those myopia control glasses as well. Okay, so do all these myopia control strategies, do they really work? Yes, studies prove that they do. Okay, here is actually it's a graph taken from something called the Brian Holden Institute of Vision myopia calculator. So they have done studies and they have come up with this something called myopia calculator. So from this myopia calculator, you can actually project what will be the future power of the child with and without myopia control strategies. Okay, here the green zone here is progression of short-sightedness in a child at 6 years of age and until they are 17 years of age. So without, with myopia control, with myopia management, yes. So if they are starting at 6 years old, they have like 50 degrees or 0.05 diopters of short-sightedness. If you employ these myopia control measures, at the end, by the time they reach 17 years old, averagely from 50 degrees, they may reach only until like maybe a bit after 300 degrees. But without myopia control, from 50 degrees at 6 years old, they have the potential to all the way reach until maybe even like more than 900 degrees when they are 17 years old. Okay, so this shows that there is definitely a great role for this myopia control strategy. It does really work. And the importance of why do we want to prevent this great progression here is, as I mentioned just now, if your power increases, your risk for those few blinding diseases I mentioned just now, they also increase very, very significantly. Okay, just want to mention, we at this LEC Eye Center here, we have this myopia control program. Basically, this is for your child. So if your child comes to us and we detect that they have myopia, so what's done is that there is a baseline refraction or cycloplegic refraction, as well as the axial length management. Axial length measurement means that we have devices like a scan. We can measure the length of the eyeball. So this allows us to monitor the progression, whether there's any progressive increase in the length of the eyeball. Because if there is progressive increase or a very fast increase, this means that the myopia is increasing at a very fast rate. And then cycloplegic refraction, as I mentioned, we have this facility here, cycloplegic refraction, and prescription of glasses of appropriate power by qualified optometrists. Okay. Many spectacle shops, they do not have optometrists. They have rather opticians who are, well, in the first place, actually, if you want to, as I mentioned, if you want to check your child's power, it is actually recommended to come to the eye doctor center because outside the optical shop, they cannot perform this cycloplegic refraction. Okay, and here, part of our program is actually the regular use of myopin eye drop as well. And then, of course, regular monitoring of your child's refraction and the axial length. If we find that there is continual significantly high increase of the myopia, the short-sightedness, then probably combination treatment can be recommended. That means apart from myopin eye drops, maybe myopia control glasses may also be considered if they are not already on these glasses, I mean. Okay, the important point here is that detect myopia in your child as early as possible, because young onset, if at a very young age they already have myopia, young onset myopia, they're actually at greatest risk of progression and acquiring increased risk of blinding diseases. That means if they're very young and they already have this short-sightedness, that means they still have many years to go for this short-sightedness to actually progress. So if they reach very high levels of short-sightedness, then the risk of getting all these blinding diseases increases very greatly. And if you correct your child's short-sightedness with glasses and all that, you should also include myopia control measures. Okay, it's just not it's not just a matter of correcting their vision, but you should also incorporate methods that can actually control the progression of the myopia as well. Okay, so include myopia control measures in the correction of your child's vision. Okay, this is a video which was played very much earlier, but I think most of you have missed it, so I'll just play it as well. Okay, so I've come to the end. Thank you very much for your time. If there are any questions, I'll be most glad to try to answer them for you.
Thank you, Dr. Lim. Thank you for the very in-depth sharing, and also as well as what are the risks of having, if let's say the children are not very well managed with their short sight problem, then this is the problem that is they're going to face as well. So Dr. Lim, now just now you mentioned like the few complications they will actually experience, or the risks they will actually experience if let's say their myopia power actually increase very high, right, by the age of 17. Because I noticed you show the chart from age 6 maybe it's like less than 100. Yeah. And then if it's with the program, it will actually come to the age 17, they will about like maybe 300-400.
Yes, correct.
If it's without, it will actually double up, it's almost 900. And then the risk of having this myopia macular pathy, is it, Dr. Lim?
Yes, correct.
Right, it's very high, as well as the retinal detachment is very high. Now, for these two, I understand that like for retinal detachment, you can actually undergo for a major procedure. But what about myopia macular degeneration problem?
Okay.
Is there any prevention on this part? Okay,
the prevention of this is actually, as I said, control the myopia. Because once this happens, basically the condition is not reversible.
Okay.
But when you have this myopic maculopathy, you will also have a increased risk of getting other conditions such as the myopic CNV, okay, which can cause bleeding, and sometimes you also can get this something called a macular hole. So this myopic CNV with bleeding, yes, there are methods to treat it, okay, and macular hole, yes, surgery can also be performed. But myopic maculopathy itself, there is no way to actually reverse the condition, so you have to prevent it by myopia control, basically.
So prevention is cure lah.
Yes, yes.
Okay. We have some question from our Facebook viewers. So from Mond. Mon Jess is asking, hi, Dr. Lim. The screen time for the children, I believe she meant, for screen time, does the screen time makes the myopia worse?
Yes, by screen time, that would mean that the child is spending a lot of time looking at things close up, looking at the screen, your books, whatever is just right in front of your face. So when they look at something close up, near, for a prolonged period of time, the eye is actually accommodating. That means the ciliary muscle or the focusing muscle in the eye is actually working very hard. So the more your ciliary muscle or your focusing muscle works, the more likely it is that your eyeball will elongate faster. So elongation of eyeball basically means that your short-sightedness increases. So that's why just now I was also stressing, limit the screen time, limit the near activity. Practice the 20-20 rule. That means every 20 minutes of near activity, look away to the distance for 20 seconds. Give some time for your accommodating focusing muscle to relax. Yes.
Okay. For the attendees from our Zoom session now, if you have any question you would like to ask Dr. Lim, you can actually unmute yourself and to ask a question, not just related with this topic. You can actually also come forward and ask any question related with eyes only lah. Okay, so we have one question from Shasha, okay, from our Zoom attendees. What happens if we just ignore and don't seek treatment for myopia? So I believe Dr. Lim have answered earlier, right? Prevention is cure, to prevent all these future or the eye problems or eye diseases that will actually happen when their myopia will be higher. Besides that, Dr. Lim, you know, what would
actually besides that, if your child has got a short-sightedness or any refractive error, it is very, very advisable to correct it, because if they are at a young age and they have refractive error and they cannot see well, they can develop this condition, what they commonly call lazy eye, or amblyopia. That means if the eye cannot see well, the nerve of the eye cannot develop normally. So if this lazy eye is not corrected by the age of maybe 9 or 10, after that, the chances of the lazy eye recovering is actually not so good already. So if the child, in any child of a young age, if there is refractive error, myopia, be it myopia or astigmatism or any kind of power, it should be corrected to prevent this lazy eye. Lazy eye means that the nerve of the eye has become weak, so that if you discover the condition too late and only then you make glasses, even if when they wear the glasses, they still may not be able to see very clearly. So that's called lazy eye. So we have to prevent that by detecting all these short-sightedness or refractive error at an earlier age and correcting their vision.
Okay. So Dr. Lim, just now you mentioned they have to come and check their eyes in order to know the problem as well, right?
Yeah.
Now, what would be the earliest age for them to come in to do their first eye check? What would your recommendation be?
But actually, I would say the earliest that the parent notices that the child possibly has a vision problem, they should bring the child in already. But it's not just a matter of refractive error, like short-sightedness is just one condition that can cause blurring of vision, but there are actually possibly other eye diseases or disorders which can also cause blurring of vision. So whatever is at any age, at any moment you notice that the child could be having problems with vision, you have to bring them in.
Okay, all right. So there's no specific age, like,
No,
because I
there's
think
no
a lot of
specific age.
a lot of parents will have actually misconcept that, oh, I will bring my child when they start going to school, when they go standard 1 and 2, you know, then only bring them. Actually,
No.
there's no specific
No,
cap,
yes. The
right?
moment you
They
notice
can
something
come
is
in
not right,
as young as 4 years old.
yes,
3
yes,
years
yes.
old, right?
Anytime you notice that something's not right, you got to bring that in.
Okay. Okay, let's go to the Facebook. We'll see. Okay, we have one question is, can myopia be prevented?
Myopia can be prevented. It can be controlled, as I mentioned.
Okay, can be controlled, but cannot be
Can be
prevented, right?
No, because there are just too many factors.
Right. Okay. Okay, for one Zoom attendee asking from Chin, hi, Dr. Lim, the Myopic eye drop need to use long term or can use when necessary, or finish one bottle then stop? What would be the plan, the treatment plan like for the children?
Well, I suppose eye drops must be used so-called long term until the child's power is stable. So you have to use, to get consistent results, you must use it consistently, because once you don't use it, you stop using it, it doesn't work anymore. That means it doesn't work to relax your accommodating muscle in the eye anymore. So this will allow faster increase in the progression of myopia. So to let it work, you must use it consistently, regularly, until such a time when the power of the eye is really stable. That means like probably at least like maybe 6 months to a year, there's absolutely no more increase in power. Then you may, and also looking at the age of the child, then maybe you can consider to actually stop it and see. But after that, if there is still noted to be increase in the power after stopping, then you may have to restart it again.
So will be based on the condition of and how the kid regression like, right?
Yes, but basically it's something that you must use continuously and regularly, rather than just off and on.
But it wouldn't be like 2-3 months only, right, Dr. Lim?
No, definitely not.
Yeah. So I mean, this is not like a magic pill or what, you know, it's just apply.
Because the child is still growing, so the power eye is definitely not stable yet. So it's definitely not something you can use just for a few months.
Okay. We have one question from UL Chang. Good evening. Is the myopia control glasses only for children?
Yes, myopia control glasses are only for children, because in adults, basically the myopia is already stable. So there is no role for myopia control glasses.
But I think because this program is mainly to target for the children, because to help to slow down the prevention. So whatever Dr. Lim have shared about the program on the eye drops, the myopia control lenses, be it with the what you call, Dr. Lim, the contact lenses as well, will actually helps to slow down the regression for the children.
This is for children.
Yeah, basically it's for children. Okay. Tammy on the Facebook have one question. Hi, Dr. Lim, would like to know what are the treatment options for myopia? Sorry, I should have read this question first. So Dr. Lim, maybe you just have to repeat again your
treatment. By treatment options, I would suppose correction of vision. Correction of vision, most commonly we have glasses, contact lenses, and for glasses or contact lens free options, then you can there's LASIK. And then again, depending on the age of person and what level of glasses free they want to achieve, there are even things like surgery, intraocular lenses and all can be considered as well.
Dr. Lim, just now we mentioned about the options for the children to slow down the regression, right? Now, does all the children comes in will go through the same treatment plan, or it based on the individual condition? That means do they have to come in like all will have to use the Myopic eye drop and then get the myopia control lenses to achieve a more ultimatum result or more stabilized, in that condition, or just only one option and then you won't see the result so fast? Would they have actually any impact?
Well, my recommendation would be at least the myopia control eye drop. I think the myopia eye drop, because once the child has been detected to have myopia, I would say it will definitely progress. It will definitely progress because it's still a child. The eye is still developing, and if there is a so-called simple option to actually do something to what they call curb the progression, I would definitely recommend at least a myopia eye drop. If they want to go for the myopia control glasses, all the better. Or if they wish to withhold that first, then maybe you can observe for maybe a half a year or a year, just to see what is your rate of progression. If there is continual significantly high progression, then yes, I think you have to consider combination treatment. That means maybe apart from myopia, you need to use the myopia control glasses as well.
So if with both, then it will be better, right? If let's say with
yes,
eye drop as well as it will be better, because somehow or rather the kid will still need to wear the glasses. Comparing to just have the normal lenses versus the myopia control lenses. Because just now you actually explain the features of the lenses actually helps to the image will actually bring it properly, you know, especially those peripheral.
The side images.
So all right.
Yes.
Okay. We have one question from Young from Facebook. Doctor, if I have floaters and the power still rising at the age of 30 and above, should I also control my myopia? Age 30 years already.
Age 30.
Yeah.
Age 30. So I don't think there's a role for this myopia eye drop because it's actually just for children.
Okay.
At this age of 30, yes, there is still a small percentage of myopes that they do progress. But the reason for this, it may not actually so much be related to accommodation or the new or screen time and all that. No, it could be just a natural progression of the myopia. That means that actually the progressive changes happening in the structure of the eyeball itself. Yes, there is, sometimes you can get myopes who, by early 30s, they still have a bit of increase in power.
Okay, Dr. Lim, I just want to ask you, just now you showed the table where from age 6 to 17, if let's say a child come in at age 4 and is already having myopia problem, would you actually start the child with, I mean, is there like a minimum age to start with the this myopia control program?
No, I think any age that they are detected have, they should start. Yes, they should start this myopia control program.
Is there a max? Is there a cap at what age they cannot start? If let's say I bring my son in and he's already like 15 years old, and he's already a short-sighted. So can he start at the age versus, of course, we didn't know earlier, right? Example. So he start at 15. So is it too late to start as well?
No, it's not too late. I mean, if it's 15 and it's still detected to be not stable, increasing at a significant rate, I would say yes. I mean, no harm. No means myopias do start. Because we must try to, we don't want the final power to be very high, because there's a high risk of those diseases I mentioned just now.
Right. It sounds scary. It sounds very scary, the risk of it, especially when we are on the higher side of the myopia. Okay. So at the moment, I do not have any other further questions. So I'm not sure whether any of our Zoom attendees have any questions for Dr. Lim. Otherwise, we will just wrap this up. Okay, so I would like to share with all the attendees from our Zoom, as well as attendees from our Facebook live session. We will share you the link of a registration for a free eye screening, okay? Because you're entitled for free eye screening. So the free eye screening will actually, by appointment, we will give you a call upon the registration. And then upon when you come in for the free eye screening, you actually entitled for a free hydration pack. It's a dry ice pack which means is eye drops, artificial tears. So the free consultation with Dr. Lim will be included as well. So you can actually click on the link to register. So this link will be open until 5 p.m. tomorrow, okay? So you may register the link. So for the Zoom attendees, if you have not able to register now, don't worry. After the session, you can go to our Facebook page. Remember to like and follow our Facebook and our Instagram page, and then you can get the link from the this webinar live session. Okay. So thank you everyone. Thank you for spending your precious evening with us. Thank you, Dr. Lim, for your
Thank you for time.
sharing. So good night, everyone. Thank you.
Okay, good night.